sleep and dreams are a bit like water and food to the psyche, to the soul, to the mind, and so on. We need both. So the bottom line here is that if we don't dream well, it has a profoundly negative impact on our memory. And in a deeper sense, it's as if we stop growing psychologically. We stop adding to who we are. I think as much as the next person, I really value being productive. I love doing things. And I learned a long time ago that that doesn't come at the expense of rest, that there's something inherently essential. And I would add something exquisitely spiritual around learning to rest. It's just as important to learn to not do as it is to do.
Hi, this is Dr. Mercola helping you take control of your health. And today we are joined by Dr. Naiman, who is a professor, assistant professor at the University of Arizona in Dr. Andrew Weil's program and focuses on the understanding, appreciation, integration of sleep into health. So welcome and thank you for joining us today.
My pleasure. Thank you.
So we have done a previous interview, and for those who haven't seen that, why don't you give a little history of your work in this area and how you came about doing what you do?
Well, I'm trained originally as a clinical psychologist, and I think very early on in my work I began to recognize that it was hard for people to move forward and address and heal emotional issues if they were sleepy, if they were tired. So that awareness began, the seeds were there early, it began to grow and grow. I also had, from the time I was quite young, sort of an intuitively based interest in dreaming. And the combination of those two experiences, by the time I was about 10 years into my career, I shifted my focus entirely into sleep and dreams. I had spent the first 10 years working primarily with cancer patients and became more and more curious specifically about the relationship of cancer and dreaming, something Carl Jung had written about extensively. So it blossomed about 25 years ago into a full-blown interest in sleep and dreams. At that time, I joined the staff at Canyon Ranch Health Resort here in Tucson, where I live, and met Dr. Andrew Weil for the first time, and found myself in a setting, an alternative, more holistic, what we now call integrative health setting, where I was able to address sleep issues in a much more comprehensive, sort of outside of the conventional box way. I did that for about 12 years at Canyon Ranch, another 4 or 5 years at Miraval, and ended up laying the foundation of what we now call integrative sleep medicine. The past 12 years I've been on the faculty, as you mentioned, the Center for Integrative Medicine as their sleep and dream specialist.
That's terrific. Thank you for sharing that. And why don't we go into some of the details of sleep now and maybe review some basic physiology as to the different stages of sleep and what they're important for, because I think that's going to be useful to really fully appreciate the insights that you have in this important area.
Well, most of us now know that we think of sleep in terms of two basic kinds. We think about sleep, true sleep, what we call stage sleep or deep sleep, and then we talk about REM sleep, which is dream sleep. I think one of the best ways of understanding those two kinds of sleep is to think of them as kinds of nourishment. Sleep and dreams are a bit like water and food to the psyche, to the soul, to the mind, and so on. We need both. We absolutely can't survive without fluids and water, and we need good, nutritious food. In the same way, we need both sleep and dreams. I think of sleep as being like the fluid that replenishes us, refreshes us, and dreaming as being another kind of nourishment, almost like food. And maybe we'll talk a little bit about how the mind actually consumes and digests information when we dream.
Okay, and most of us, I think the most recent statistics I reviewed suggest that people aren't sleeping enough. I mean, the average person is probably sleeping under 6 hours, where if you're, and you may have better data on than that, but I think it may be more optimal to be getting closer to 8 hours. So maybe let's just touch on that and how that impacts the quality of our life.
Right. I think the best data we have suggests that the average American is sleeping just under 7 hours,
Oh,
6.8,
yeah, a little more. That's good.
yeah. And for the average person, it absolutely isn't enough. We have to keep in mind that sleep debt accumulates. If somebody is missing, say, an hour of necessary sleep per night, and if they're sleeping an average of 7 hours, at the end of 7 days and 7 nights, they will have lost the equivalent of a full night's sleep. And even though, and many of us do this, even though they might not notice an obvious change in their functioning, the reality is they will function as if they had been up the entire night. And there's a danger in that, in terms, of course, in terms of accidents and performance and so on. So yeah, we all need to get the right amount of sleep. And it does vary from person to person, and it might vary, I think, a bit from season to season, and depending on our health condition, our age, whether there's pregnancy or we're taking care of young kids and so on. But the best way to measure if we're getting the good quantity of sleep that we need is by looking at the quality of our waking day. If our energy is basically sustained, and of course energy flows in rhythms, it'll come up and down through the day little bits, but if we're not conking out constantly, if our energy is sustained through the day, then we're likely getting good quantity and good quality sleep.
And isn't it true that one of the most important components of sleep is the REM sleep, which is what we dream. And when we cut our sleep short, sleeping just under 7 hours as opposed to the 8 hours or more that many people need, that's when most of the dreaming occurs. It occurs in the final phases of sleep before you wake up. So why don't you expand on that?
Absolutely, thank you. This is a point I'm just deeply concerned about. There's been so much media attention, necessary attention to the fact that we're sleep deprived. But it looks to me like we are at least as dream deprived as we are sleep deprived. And as you're saying, because we get most of our REM sleep, most of our dream sleep in the latter third of the night, that's what we tend to lose. More people most insomniacs, I should say, tend to have trouble sleeping through the night. So they'll wake up 1, 2, 3, 4 hours before the sleep is done, and they are not so much losing sleep as they are losing dreams. And the other part of this is that if we routinely wake up with an alarm clock, which I think the vast majority of us do, we're actually snipping off the end of our dreams night after night after night. And the metaphor here is that if we have a really good novel, it's as if we're tearing off the last 20 pages. It'd be very, very frustrating. So yes, and dreaming is essential. In recent years, there's been a lot of research underscoring the fact that dreaming has functions very different than sleep. And I mentioned just a few minutes ago, I think of the dream as being a digestive and assimilating process for information. Just as in recent years, we've heard a lot of reference to the GI tract, to the gut, as being the second brain, because there are all kinds of neurotransmitters that we thought at one point belonged only to the brain. We find them in the belly. There's a wisdom associated with digestion, if you will. There's a process of careful screening and selection of the food we eat. And the belly determines what it's going to keep, what it will assimilate, and what it will let go of. Likewise, what we're finding about REM sleep and dreaming is that the brain, in one sense, becomes a second gut. If we think about all of the information that we're exposed to in the course of a single day, the conversations, the things we read, the things we see and hear and think about, the things we just experience all around through our senses, all of that information can be understood as something we consume. The brain consumes this. And what happens in REM sleep at night is all of this information that we've metaphorically swallowed is digested and assimilated. It's sifted through. Again, in its wisdom, depending on lots of factors, the brain decides what it's going to keep and what it's going to let go of. And I think as this information is digested, that process of assimilation shows up metaphorically in the dream, in the images of the dream. So the bottom line here is that if we don't dream well, it has a profoundly negative impact on our memory. And in a deeper sense, it's as if we stop growing psychologically. We stop adding to who we are. The best way to ensure that we're getting good quantity sleep and quality sleep is to get to bed on time. Most of us have much more control about when we go to sleep than we do around when we get up. Because the world has expectations and demands. There's children, there's work, and so on. So, and this is a problem where people tend to steal time. They steal sleep time at night. You know, there's a decision about, well, I'll get this done as a piece of work I want to get done, or there's some housework or some dishes or phone calls. And people tend to make waking life a lot more important than sleep. And the irony in this is that the quality of waking life depends greatly on the quality of our sleep. I think of the bedroom as being a portal. Of course, it's another room in one's house, but it's also a passageway. It's almost like a stargate because it's going to take us to another place. In fact, I like to think of the bed as a magic carpet. The notion of a magic carpet actually comes from the bed because the bed will fly us to other lands in the dream world. It'll take us to other places. So when we begin to think of it like that, we restore a sense of mystery that is so essential. And I think when we step into the bedroom, we need to think about this in the same way when we step into a movie theater. You know, most of us instinctively, as soon as we go into a movie theater, we change consciousness. We quiet down. In fact, the word I use is we hush. And by the way, of course, this is the name of my new book. Little segue. My most recent book published last month is called Hush, a Book of Bedtime Contemplations. But it's about remembering something we'll know in our hearts, that we need to shift consciousness. So we step into the bedroom as if it's a theater of sleep. And in the same way, when we step into a theater, there's an expectation that we can just relax and be receptive, and something interesting, useful will come toward us. We can do that as we step into the bedroom. And in a practical sense, of course, that means the bedroom needs to be dark and quiet and cool, and as you're suggesting earlier, also free of subtle energies. A lot of people don't recognize that electromagnetic currents create electromagnetic fields, and at a very sort of imperceptible level, sometimes the bedroom is just buzzing with energy. So we want to address that. We want to dial that energy as far down as we can. Years ago, if we go back 100 years, the treatment for anxiety, the treatment of choice for anxiety, was to send people to the country. And I think there was we used to laugh about it, but now we recognize that there's something about getting away from all this energy, even back then, was very helpful. And I think what we're talking about is creating that kind of quiet. You know, we want to reduce that buzz of energy. We also want really clean air in our bedrooms. That's very important. And that can be done with plants, lots of ordinary hair plants, clean air. It can be done with HEPA filtration. So this is very important. In terms of alarms, I think if we have to use an alarm, and many of us do on a routine basis, some of us only if we have to catch an early plane somewhere, but if we have to, I think it's better to opt for some of these newer gentle alarms that will not blast you out of bed, you know. But you can get these for smartphones, or you can get them built into regular alarms. One of the things I strongly recommend, in addition to having sort of a soft graded alarm system, is that we modulate the light that comes out of these digital alarms or digital clocks. Many of them put out pretty intense white or blue light, which is the worst thing for sleep. And we need to keep in mind that light trickles across the closed eyelid. And there's evidence that kind of exposure to light at night not only compromises sleep, but it probably increases the risk for certain illnesses, including cancers, over time. So we want to minimize the light, or if we're going to have light, we want to have a low blue light, which is more along the amber or red spectrum of light. That doesn't suppress melatonin, which is why all this is a problem. So we want to dial the light down at night.
And that's one seems to be one of the mechanisms. Is people might wonder how sleep is connected to cancer, and at least one of the theories is the suppression of melatonin because it's a very potent anti-cancer benefit. But it doesn't work if you take it as a supplement. It works when your body makes it naturally.
Right. Well, I think it works. It can work both ways. Melatonin is a pretty simple molecule, and I speak and write a lot about melatonin replacement therapy. I think we need a good quality melatonin. There's still a lot to learn about it, and I think a lot of the melatonin on the market turns out not to be sensitive to the circadian aspects of it. Normally melatonin levels are very low during the day. They rise up very gradually at night. They're still pretty low through the first part of sleep. They increase, and melatonin levels peak in the brain and the body and the gut as well in the last 2, 3, 4 hours of sleep. They're actually peaking when we're dreaming. So high levels of melatonin are associated with REM sleep. I think the loss of melatonin, which I think is epidemic in our world, is also associated with decreases in REM sleep. Most melatonin products are instant release, and because melatonin has a half-life of about 45 minutes, you'll get a spike. If you swallow it around bedtime, you get a spike that'll come down pretty quickly, and it almost is the opposite curve you see in nature. So I tend to recommend a sublingual variety under the tongue so it's absorbed and it avoids the first liver pass, and also a sustained release or continued release variety. So you're somewhat mimicking nature a little more closely.
All right, so if someone needs melatonin, and there's certainly, it can be useful as a bridge, I guess. But you're suggesting two forms. One is a sublingual for the quick release, and the other is an oral, swallowed, sustained release one.
Right. Well, or a combination of the two. There's some companies that make a combination of the two.
Sublingual, that's sustained release?
Yes.
Oh, I wasn't aware of that.
Yeah.
Interesting.
I do think we need to realize if we're exposed to light at night, even in the hour or two before bed, we're suppressing melatonin. The brain gets a signal when it's exposed to the blue wavelength of light. It gets a signal that it's daytime, and that suppresses melatonin. So if we're watching television, screens, TV screens, computer screens, iPad screens, telephone screens, all of these put out a lot of blue light. So we want to really be cognizant of that. Either wear glasses or goggles that screen the blue light, they're called blue blockers, or put screens into our computers. There's a free program called Flux, F.LUX, that you can download onto your computer, and your computer will automatically change the quality, the wavelengths of the light when it detects that it's evening time, and that'll help a little bit. But we really need to reestablish a good relationship with night. If you ask people who don't sleep well to explain why they think that's the case, they'll tell you that at night in bed they are exhausted, they're spent, they're fatigued, but they'll add that they feel they're just not sleepy enough. And what's interesting is what the research shows us is that they're plenty sleepy. They think they're not sleepy enough because they're too wakeful. So sleep problems don't typically occur because of a lack of sleepiness or inadequate sleepiness. They occur around excessive wakefulness. We're running too high, too fast. I think that the most critical bridge that takes us from waking to sleep is the bridge of rest, true rest. And we live in a world, too, in this hyper-aroused world, where we've forgotten what rest is. When people rest, they actually are just shifting into different kinds of activities. People often rest or people often confuse rest with recreation. They're going to go to a movie or go on a hike or go bowling or do whatever. These are recreational activities, not true rest. And people often confuse rest with inebriation. We live in a world where people consume too many mind-altering substances. A glass of wine, of course, can be fine and healthy for some people, but people consume too much alcohol, people consume too much pot, and so on. Inebriation is not rest. And true rest most of us now know, involves the practice of, well, I think of these as rest practices, but the practice of something that allows us to be receptive, to really slow down.
It seems like napping would be one of these strategies or habits, resources that one can use to increase rest, as you defined it. Are there any other strategies that you practices you recommend?
Yeah. Meditation, I think, is a great one. There are many different forms of meditation available today. Probably the best known one is John Kabat-Zinn's mindfulness-based stress reduction, which is taught all over the world. They're trained people who do this, and it's extremely helpful as a way of resting. There are other forms of meditation, other forms of mindfulness meditation, vipassana meditation, and so on. There are technologically assisted ways of resting, heart rate variability, M-wave techniques, biofeedback techniques. There's hypnosis, there's self-hypnosis. I think there are somatic channels. I think yoga is an incredibly, really good way of resting. There's a yogic technique called nidra that I often use with people, which is, we can think of it as a guided meditation that involves really learning to deeply relax the body. There's progressive muscular relaxation. There's certainly no shortages of roads that will take us to rest.
I'm wondering, you had mentioned that most men over 50 tend not to have much deep sleep at all. And maybe you can comment on the consequence of that practice. And then if you're aware of any specific strategies that could, other than increasing the length of time you're sleeping, which I imagine would help, to actually convert some of the REM to deep sleep to compensate for that.
Well, I don't know that we would need to convert. I think we want to hold on to, we want our sleep to include about a fourth of our sleep should be about REM sleep, 20-25%. When we lose deep sleep, whether we're male or female or any age, we end up compromising immunity. What happens when we go to sleep is we dissipate energy, and we literally cool. There's a release of energy. A lot of heat, if, for example, comes out of the head. And through the night, we get cooler and cooler. And by the way, this is one of the functions of melatonin. Melatonin dilates peripheral blood vessels, so it opens up these vessels under the skin, which allows heat to be dissipated. We want to cool at night. So we're
Never knew that. It's a vasodilator.
It's a vasodilator, yeah.
Wow.
So we're giving off heat at night, and we're quieting. The remaining energy is diverted toward maintenance, which is pretty complicated, cleansing, and a lot of that involves the immune system galvanizing at night. That energy is directed toward immunity. When we have compromised immunity, and I'm oversimplifying stuff, of course, but we increase the risk for chronic inflammation. And there's just a growing mountain of data showing that poor deep sleep is associated with increased risk for viral infection, increased risk for cancer, increased risk for cardiovascular disease, increased risk for neurodegenerative disorders, autoimmune disorders. It just goes on and on. So there's something so fundamental to our health around immunity that happens in deep sleep. Probably one of the best reasons to get deep sleep.